Hi, my name is Ashley Levatino. I'm a registered nurse in the operating room at SUNY Upstate Medical University Hospital with experience in the adult emergency department. I've been a nurse for 5 years and I'm working towards my second year of the family nurse practitioner program. I have worked with both the adult and pediatric population with experience at Upstate Medical University as well as New York Presbyterian Hospital Columbia University campus in New York City. I am interested in palliative care and hospice care because my prior experiences have provided me with growth and learning within my nursing profession. However, they have not been able to provide me with situations involving palliative care or holistic approaches during the end-of-life process. In both the operating room and the emergency department, palliative care is not always provided due to the situational circumstances of unexpected events leading to death, and simply because of emergency situations that require critical, efficient, and high-intensity care during this period of time. This being said, however, has me intrigued and interested to continue learning more about palliative care and the end-of-life care from a more formal perspective. I do find palliative care important because during this unfortunate time of death amongst our patient population, they should be most comfortable whether it is with their family or amongst other wishes they have requested during this phase of their care. The purpose of this video is to find a useful website resource related to palliative care that we find helpful when navigating through research as such. The organization that created this website is called the National Hospice and Palliative Care Organization, and the name of the website itself is called Advancing Healthcare with a Model That Works. The NHPCO enhances and expands access to care that addresses holistic health and the well-being of communities. This layout is outstanding for those who aren't familiar with navigating through websites. So there is a menu tab here that lists a table of contents which helps navigate through this website. You can click on any one of these tabs. It'll tell you what NHPCO is about, how to become a member, hospice care, palliative care, and the differences between the two of them, regulatory quality, education, advocacy, resources, and how to find a care provider. You may also become a member. So you can become a member by clicking on the link below, creating an account, or if you already are a member, you can log in here. Learn more about the NHPCO. That link leads you to this page, and you can learn more about trailblazing a person-centered healthcare model, who they represent. It says here that this website was founded, or not the website itself, but NHPCO, the organization itself, was founded in 1978. And they are based in Washington, D.C., which is pretty cool to know. How they serve and lead. Their mission, vision, and values, which I want to take a minute to talk about. So their mission is to lead and mobilize social change for improved care at the end of life. Their vision is a world where individuals and families facing serious illness, death, and grief will experience the best that humankind can offer. Their values are what they believe in. So they believe in service, respect, excellence, collaboration, and stewardship. It also lists here some strategic priorities, so there's a link for that. And if you continue scrolling down, you can see other links that you can click on to join the NHPCO, their affiliates, annual reports, committees and councils that you can become a part of, their governance, jobs at NHPCO in which you can apply to if you're seeking employment, their leadership, advertising opportunities, and the press room. I'm just going to click on this to go back. I'm actually going to go to the home page. So one of the main reasons why I chose this website was because, for the simple fact that it's a well-known site. It's a lot of my coworkers and classmates refer to this site and when they're researching palliative or hospice care. However, when you do research this site, it gives you the home link right here, but it also is designed and laid out in a nice format, which is, you're able to click on other contents within this site below it. So you have resources, what the website's about, the education, conferences, hospice and palliative care, and the membership. So that's one thing I liked about it. And then when you click on the home page, or when you click on that link, you come right here. And the design and layout is organized and very easy to read and navigate through. I think that when choosing a website to research, the design and layout is what draws most people's attention, and the compatibility that you can have when navigating through the website. You don't want it to be challenging. You don't want to have difficulty finding what you're looking for. The NHPCO website is laid out very nicely. So I'm going to click on one of these links just to show you an in-depth, how to go further when you're looking at stuff. Go to hospice and palliative care. So under hospice and palliative care professionals, you'll see what it's about. We can click on this link and learn more. So it kind of just leads you back to the stuff that we've already covered. I'm also going to take you to becoming a member. So before you actually become a member, they want you to read up on some information about the membership organization itself. So they have different memberships: hospice membership, corporate member, partner membership program, associate membership, member advantage program, palliative care membership, and just like a welcome link, as well as my NHPCO and the MSDS program. So I'm going to click on hospice membership, which goes into detail about the value of the membership itself. And once you scroll down after reading all the links provided, you can hit become a member. And it tells you what this actual membership gives you access to, which is good to know. And then once you're done reading all that, you can hit Act Now, Join Now, or just scroll down. You can either, I'm guessing that you have to like print this, and then there's a website that you can, or an address that's provided on here down below that you'll mail it into. But you're able to complete your contact information, your demographics. This gives you information about dues and optional services. And it'll ask you for payment information and any additional information that you need or that is required. So that's just how to become a member for the hospice care. So that's just like an in-depth demonstration on how to navigate through there, because there is a lot of other programs that you can join, so it makes it nice that they're laid out in different areas. A minute to navigate through hospice versus palliative. So I clicked on hospice care just so that we can understand that the overview is different. So it's considered to be the model for quality, compassionate care for people facing a serious or life-limiting illness or injury. Hospice care itself involves a team-oriented approach. So this gives you more information about the history of hospice, hospice facts and figures, standards of practice, models and demos, Medicare hospice benefits, so on and so forth. And then if you navigate through palliative care, it'll give you the palliative care overview. So it's patient and family-centered care that optimizes quality of life by anticipating, preventing, and treating any suffering that's occurring. And if you scroll down, there's like the membership links that we talked about before. But this actually goes into detail about the CMS palliative care information, explanation of palliative care, helpful resources, palliative care education, the playbook, other resources, and pediatric palliative and hospice care, which is also essential when navigating, because we're not just focusing on the adult population. This can be a pediatric population issue as well. So it's nice to just understand the difference between the two and what's offered beneath each section, because people who visit this website who aren't familiar with palliative or hospice care are able to navigate easily and see the difference and in detail. So you can click on the explanation, for example. Let's click on this just to see an explanation of palliative care, which goes into detail, which I think is huge. Care is provided and services are coordinated by an interdisciplinary team. Even for me at the beginning of this course, I knew what palliative and hospice care were in relation to end-of-life processes, but as I had mentioned in the beginning of this discussion, I'm not exposed to palliative care or hospice as often in the emergency room and operating room, so this website itself is one of the reasons why I chose this website was not only just the layout and the design, which was easy to navigate through, but because it taught me a lot when I was navigating through. I was able to learn more about palliative care and hospice care in relation to the end-of-life processes. So I'm just going to click on the home button here. I'm going to go back to the About page, maybe. Well, let me navigate. I'm going to navigate back to the home page, and while I do that, I just want to explain that after reviewing the SEERS, it's the Source Educational Evaluation Rubric, when comparing it to this rubric, I find that this website is very resourceful. If you look on the bottom here, it's cited 2020 under the National Hospice and Palliative Care Organization. So its citation is accurate. It's cited properly. It's very authoritative in an educational standpoint. Highly regarded site that is referenced and linked to by others. Information is well referenced, cited, and written by the authors. So I think it's highly credible. It's authoritative. The educational value is outstanding because it gives content that exceeds instructional goals. The site is highly respected, so the intent is highly credible. The site is a primary source of original content and viewpoints, and it is a high quality site that is easy to navigate through. So this being said, I find that this source is reliable and is cited appropriately when comparing it to the Source Educational Evaluation Rubric. Summarizing this website, and now that we've reflected on the citations, the SEERS rubric, what the website itself is about, and the organization that founded it, and the purpose of the video, wrapping it all up, I think that this site would be essential for all populations. It's essential for people like myself who work in the healthcare field, who, when I need information in regards to palliative or hospice care, I can easily navigate through this website. I think it's also essential for the patient population and their families to be able to utilize this website, being that it's so easy to navigate through and it provides a sufficient amount of information in an organized manner. I think that the general patient population will find this resource very helpful. I think that professions that would most benefit from it would be the healthcare profession teams, providers, any provider, nurse practitioner, physician assistant, attending physicians. I think nurses will find this helpful. Palliative care specialists, to keep up to date with what's on the websites, because things change daily. And like I said before, it's a very reliable resource, which makes it, it makes me feel more comfortable using it when incorporating the information I'm learning with my practice as a registered nurse from here on out. So I'm glad that I came across this NHPCO website. I've learned a lot that I'm now able to portray to my patient population in relation to hospice and palliative care. Even if it's not now in the operating room, I'll be able to portray this within my practice as a future family nurse practitioner. So I hope that you all find this website helpful, and thank you for your time.